morning, everybody, and welcome to the Straumann Arena of Confidence. My name is Francesca, and I'll be hosting this morning's session with Dr. Christian Mal, who will share with us some tips to start clear aligner treatment. So welcome, Dr. Mal. Thank you for being with us today.
Thank you very much, Francesca. I'm very proud to stay here and this morning. Really proud in this arena. It's very amazing. Yesterday I came here for seeing the party. It was very, very amazing.
It was, absolutely. So thank you again for being up with us and sharing your experience with clear aligners. So before we get into the topic of clear aligners, I wanted to ask you a little bit to introduce yourself to the public as well. So a little bit about yourself and your practice.
Okay, so I'm just working now, 14 years in a private practice. Not only in one private practice, I'm coming from Freiburg, Germany, and also I stay in Basel with some guys together in a practice. And I'm urgent from my education. I've been in the University of Freiburg about 10 years. And my specification is oral surgeon, so I'm an oral surgeon. Yep. Afterwards, I've done perio, and at least I started to do also orthodontics. So I am also a specialist in orthodontics. And so I was very proud of it that Straumann started with ClearCorrect, because so I can a little bit augment my practice was also doing clear aligners, for example, in top of oral surgeon.
Absolutely, that sounds like a great combination.
That's
it. And talking about clear aligners, and that's the focus of today, what types of cases do you treat with clear aligners in your practice?
Okay, nowadays, the understanding has been modified that also most malocclusions can be treated with clear aligners as a result of procedure has become much more sophisticated in the last recent years. And so after being clarified, is this a real clear aligner case, for example, you can do really everything what you want, like for example, gap opening, gap closing, resolution of primary and secondary crowding, post-retention crowding, and sometimes it is also easier to complete a treatment with braces after treatment with braces at the end with a number of some aligners.
Okay.
The finishing can be better achieved with it, but it would be sometimes very easy. In general, also, of course, mainly orthodontic cases, not primarily orthopedic cases.
Right.
That would be a little bit more difficult. And the reason why I use aligners in my treatment portfolio, apart from some limitation, is that offers some insignificant advantages. For example, they are removable.
Yep. Absolutely.
I've seen it, so I can talk about it. I've seen that you wear a liner.
Yes, I do.
Nobody will see it normally. I will see it as a specialist, and it works good. I see it also.
I hope so.
It takes a little bit more time in the lower jaw, but the result would be very good, I'm sure. And the more advantages would be also to take it out. I've talked about before. You can brush your teeth. Home care is easy. Dental floss and so on would not be limited. And regards to periodontal condition, for example, they therefore would be really intended to be superior to a fixed appliance. Yeah. Also, one advantage would be that for special client, like example musicians, they can take it out for the moment, and yeah, so there are a lot of advantages to use aligners.
Very interesting, very good points, and you know, for someone who wants to start providing clear aligner therapy, Um, what would you suggest as a good starter case?
Yeah, I would start, for example, with moderate frontal crowding and spacing, little protrusion of the teeth in the front, for example, retrusion of the front, low intrusion and extrusion with use of auxiliary attachments called engagers.
Engagers.
And probably also for a starting case, a stable neutral intercuspidation. So you don't have to change a lot of teeth for the normal occlusion, but you have just right now a normal occlusion before you start. And what means more specifically, I would start following a case with a mid or simple crowding in the anterior region, and the lower or upper jaw is quite okay. Within a class 1 occlusion, what I told you before, with a deviation from the norm not more than approximately 3 millimeters.
All right.
And what is also important to say is that to ensure that the treatment can be carried out successfully, the patient must be obliged to wear the aligners every day and all day.
Many hours, huh?
Yeah. You know it.
I know something about
And
that. Yes, I do.
You're a compliant patient, I'm sure.
Yes.
And it is like, but it is easy normally that the patients are compliant because they normally the patient comes in my office. It's an adult person normally, and so they pay for it because it's not covered with insurance.
Yep.
And so they want to be treated as fast as possible, so they will wear it normally.
Absolutely.
Yeah.
Great. And you mentioned to me before you have a case also to show us. I'm sure that's very interesting for us to see a real example of how it works.
Yeah, for example, here you see when I show you, it was the treatment plan of a patient, a young patient, a young mother, was disturbing a long time her gap in the front.
See that, yeah.
And she didn't want to be treated in the lower jaw. I've told her, please do it, because it would be better to adjust everything in this moment, but of lack of money, she told me she wanted to only to close the gaps. And that, for example, would be a really easy case for starting, for when you're a general practitioner, for example. And you see here, it's about quite 4 millimeters of gap, and it was one of my first also clear aligner cases what I started with, and in about approximately 9 sessions, 9 aligner steps, the gap has been closed. And I'll show you the next picture. So yeah, that's seeing from the treatment setup also approved, and we will see now if it will fit. It will be the same when we show the situation here. It's really in the mouth, and you've seen that the gap has been closed. Normally, sometimes a little bit difficult also because the soft tissue will be pressed together, and you have to do a little surgery treatment also to cut the papilla. In this case, it wouldn't be needed. So the result, in my opinion, is very good. Not treated at the end, because you see, for example, on the left lateral incisor, it's not in the right position when you compare it to the right one. It's a little bit higher, but I would adjust it as an orthodontist, as specialist, as perfectionist. also, but she didn't want to do it. I mean, but in my opinion, it's very good case, for example, to start.
And I imagine the patient was satisfied with the result.
Yeah, you can see it in the next picture here. You see her, she's smiling,
Yes.
and she has a great smile, and was very happy with it. Important is also to wear a long time a retention aligner at last approximately about for 2 years, I recommend. If not, it start again. Nature is very strong, so it will I'm sure that the gap would be opened as soon as possible if she wouldn't wear anything else afterwards.
Absolutely, great. And after seeing this case, I'm also curious to know how much chair time you need for clear, correct treatments.
So in general, much more less. Because in comparison to braces, for example, because patient comes and you have the aligners and nothing else to do. You have to adjust a little bit the aligners to show or to see if they will fit. And also, even when you're gluing, for example, attachments and gauges, if you've done it a few times before, it will be very fast, and everything will be fast with it. Well, with more complicated cases, for example, more time is also needed, sure.
Makes sense.
But on average time, you just need 15 till 20 minutes per chairside time. No, that's nothing.
Fantastic, yeah, sounds great. And a little bit to the patients, is it difficult to find patients, to get patients for this type of treatment?
What do you think?
I guess not, but being a patient
you.
myself.
No, it's not really. The awareness of aesthetics is nowadays very important, very important. But many patients only lack the courage to ask about it. And a small hint often will help, and you get the stone rolling. But one should only be careful not to put aesthetics alone in the foreground, in my opinion. I always emphasize aesthetic follows function, and if the function stands, one has also arrived at what we commonly perceive and define as pure aesthetics. And so, but the main point for me also, and coming patients also in our practice, for instance, that when patients ask afterwards, after treated the children, because they see that it works.
Yeah.
And they ask also, oh, look at here, please.
I also
have some crowding here, and I forgot to take out my wisdom teeth, for example. And could we do something? So that's it.
Also another way to get patients.
To get patients. No.
Great. And you know, when you start a treatment, what do you need and how do you prepare?
Okay, nothing special.
Okay.
I go forward because there's still our pictures from this case, also treatment plan. Way too fast with our discussion here.
Sorry.
What I need is a treatment plan. For first of all, I need my faces, my sets of clear liners, and my special actually aligner step. And what sometimes I need is engagers. So you see, that's nothing special.
Yeah.
Normally, I could show you now that I need, for example, some resin to put it on, to glue it, and so I just can, when a tooth will be rotated, for example, I can better derotate the tooth when I put on this kind of engages. That is something what I need special to show in some courses or also seen in YouTube videos. And for example, in ClearCorrect, there's a very helpful, very super helpful support on the homepage how to manage it.
Fantastic.
And they help every time how to work, how it works with it.
Great.
Next thing would be also to for stripping when you have too large teeth, for example, when you have to adjust, for example, the arch, and you see with a discrepancy of the largeness of a tooth and the arch of your bone, you have to take away sometimes a little bit of your animal. And that's called stripping, or IPR, interproximal reduction. And you do it like a metal strip, sometimes after the treatment plan of ClearCorrect, for example. And so it will be adjusted, you receive more space, and that's quite a little bit like not cutting nails, but making your nails.
Yeah,
it's a
filing
strange,
them,
filing your
yeah.
nails is a little bit a strange feeling for the patient sometimes. But if the patient agree to do it, it would be very sometimes necessary.
Okay.
Yeah.
Great. And regarding checkup appointments, is there something specific to know about that?
So depends a little bit on how you can use the aligners, or you can tell your patients how often they will wait. Not how often, in what kind of sequence.
Yep.
I do it often in 2 weeks apart. So I give 2 packages to the
Okay.
patient when he will come. And so he will come back in 4 weeks to give him the next packages. So I see him frequently, but in my opinion, very, very important. Some practitioners do it like 2 months or 3 months.
Yep.
Like, for example, also other companies will do it. But I will see my patient. It's very important to see him. And so I just see also what happens and what will not work. And I don't know if you heard about Dent2Go, for example.
I
that
have.
would be, yes, that would be really a nice thing about it, when patient can control it at its own,
Yeah.
combined with my practice. So I see sometimes if the patient will come back earlier, or going on
Yeah.
with the next treatment, with the next step. That would be a very nice idea. I'm very excited to see what's going on with this system. And
That's great.
so that's all.
Great.
In principle.
And also exciting that you see such a good potential for to integrate Dent2Go. That's also really great.
Yeah, really.
And
excited.
you know, to sum up, I'd like to know, and I think also the audience here and at home, what would be your 3 most important tips for starting?
Only 3.
As many as you wish.
No. First of all, make sure you understand your patient's specific aesthetic complaints. Could be the position of his teeth, may concern him. Black triangles, for example, shape, color, visibility of gum. So treatment modality depends upon the goals of the patient and the doctor. That's important. So also important is trust yourself and your skills and abilities, and start with a smaller case. So you see, you can improve yourself with coming up several cases. Start for looking for a patient who is expected to be compliant.
Yep.
I've told you before.
Yep.
And also probably don't start first case with flex, There are two different kinds of type you can order.
Okay.
Don't do it in the first case. Probably better to order unlimited, unless it's a little bit cheaper, more expensive.
Yeah.
Not cheaper.
No.
That gives you and your patient the security that it will work, no?
Right.
And be a successful case afterwards. And yeah, take the time, for example, and opportunity to attend the training courses
Yep.
offered. That would be important. And yeah, follow the protocol, general guidelines given from the support of ClearCorrect, for example. And of course, keep in mind, every patient is different. And so always your results may also vary.
Absolutely.
That would be my most important thing to think about.
Great. So on this note, I'd like to thank you very much for sharing your experience and especially your tips for getting started with clear aligner treatment. It was an absolute pleasure to have this chat with you.
Was mine.
So thank you very much, Dr. Mal, for being with us.
Thank
and
you.
That's it from the Straumann Arena of Confidence for now, but make sure to stay tuned for the next session with Dr. Sam Daher, who will talk to us about the digital ecosystem. See you later.
Thank you.